During this global health crisis, there are 7 things you can do right now to protect your patient's health and your income, including exactly what you and your team should tell your patients about coronavirus, and we're starting right now.
And now, Amazon #1 best-selling author, Dr. Tom, the Gems Guy, Orent.
Greetings from Planet Gems. I'm Dr. Tom Orent, aka the Gems Guy, and welcome to the Dental Goldmine. Whether you're with me for decades or maybe it's your first time here on the planet, if you're a general dentist and you want to have more fun, work less, and make more money, if you want to help your patients accept optimal care, well, then you're in the right place. True story. 20 plus years ago, I was over $1 million in debt, middle of a divorce. I was being embezzled, and I was 3 days from bankruptcy. I discovered one gem here, another gem there, and before long I had turned my practice around. At age 46, I sold my practices. Financially, I could have retired if I wanted, but I love sharing the gems. If you want to transform your dental practice, reduce dependence on PPOs, hey, have more fun and make more money, subscribe to the channel and click the bell notification so you won't miss a thing. Gem number 7, what to tell patients. Exactly what should you and your team be telling patients about coronavirus right now? I'm going to share with you what I believe you should be saying, but I'm not an attorney, so do check with your attorney to ensure that you're doing the right thing. I've broken it down into 5 key sentences, but you got to walk your talk about infection control, meaning that in the script we talk about infection control. Make sure you and your team are all on the same page. Okay, here's exactly what I recommend that you say. Mary, we appreciate your asking. In fact, we want you to know exactly what we're doing about this situation. Dr. Smith has always trained our team to be over the top, fastidious about infection control, going back as long as I've worked here, and I'm sure well before that. Our practice meets or exceeds all local, state, ADA, and CDC guidelines for infection control. And Mary, in order to best protect you and all of our team, we're currently asking patients not to visit our office if they have any signs of cold, flu, coughing, or sneezing. Mary, if a patient with signs of cold or flu has a dental emergency, infection, pain, bleeding, or swelling, we recommend that they visit their local emergency room. You can help our colleagues in the comments section below. Please tell us, do you feel it's appropriate in your practice to ask patients who have flu-like symptoms to refrain from visiting your practice? Be sure to watch the whole video. 2 things you won't want to miss. 1, a list of outside-the-box, really smart things that dentists have started to do. The other is access to a global dashboard, showing not only where and how many new cases have been diagnosed, but equally important, the rate of recovery from the virus as well. Also, 3 additional sites you'll want to bookmark specific to dentists and infection control. Gem number 6, increase your marketing. Tom, are you nuts? Increase your marketing now during crisis? Well, not if you're in a state that's been told that you can only see emergencies, but if you're still in a state where you can continue to see patients, this actually would be a really good time to market. You'll be marketing in a vacuum. If you're finding this helpful, please click the like button and share the video with team members and other dentists, our colleagues. Share it via Twitter, Facebook, Instagram. That would be super helpful. Gem number 5, fix the missing link, which is recall. Now, you're probably sending out text messages and emails, maybe using Solution Reach or Revenue Well, Lighthouse 360, Demand Force. They're all great. Continue to do that. Hopefully you're also sending postcards or letters, and that's good too. Continue to do everything you've already been doing, but the biggest black hole in dentistry when it comes to recall, not just during crisis, but year-round, the biggest void is in the recall calls. They're just not done effectively. You should be dedicating a minimum 1 team member, 16 hours a week, every week, just to recall calls with nothing else done during that 16-hour period. That's a 1 doctor, 1 hygienist office. For example, last week, Dr. Jarvie, one of our GEMS family members, he added 14 patients back into hygiene in the middle of the crisis. That was just 2 nights, 2 very short nights of calls. Point is, there are things that you can do right now to help your patients and your practice. We don't have time for every detail of who should be making these calls and exactly when, and where should they be situated, which is also important when they're making the calls, how to compensate them. GEMS family members, ask your personal GEMS concierge for the team training titled how to double hygiene recall. Now, if you're not yet part of my GEMS family, we'd love to have you. For a limited time special offer, go to dentalgoldmine.com. Gem number 4, the new patient tour. Develop a carefully scripted new patient tour using what I coined geographic cues. Geographic cues help the team members to remember 3 or 4 scripted sentences, something very important about the practice, and as you're walking through the practice from the front door back to the operatory, you'll go by certain areas and each one triggers one of those scripted sentences. The new patient tour should always be done before the patient is filling out forms, before they're seated. Right when they walk in, really welcome them as if they were a guest in your home. As you go by the diploma, the diplomas and societies that you're a member of, and CE that you've taken, maybe major continuum, perhaps you're faculty at a dental school. As you go by that wall with all that cool stuff on it, the plaques and diplomas and things, your team members should be triggered to say, whatever it is, you choose one of those plaques or one of those diplomas, something that you're really proud of, and the team member would say something like, "We're so proud of Dr. Smith. He keeps us on the cutting edge, the leading edge of continuing education in dentistry. In fact, he got this certificate when he became a fellow of the American Academy of General Dentistry. Did you know that our state only requires 20 hours of continuing education per year, whereas to become an AGD fellow, which he did, it required a cumulative minimum of 500 hours. When you walk by the x-ray machine, the team member is triggered to say, "We only use state-of-the-art digital x-ray, which reduces radiation by as much as 90% that of traditional x-ray systems." As you go by the sterilization area, which was always important but today critical. Now, I wrote this script as part of my team's new patient tour over 2 decades ago, but again, today, more important than ever. "Mrs. Smith, our practice meets or exceeds all local, state, ADA, and CDC guidelines for infection control." Then I would add 2 or 3 comfort, kind of high-touch things that you do for your patients. If you offer warm blankets and heated neck pillows, of course with disposable covers, maybe you have a TV in the ceiling of each operatory, or VR glasses, or perhaps you give lip balm to each patient to keep their lips moist during the visits. Whatever the things are that you do to make patients feel a little bit special, mention those things as one part of this tour. Gem number 3, the 10-foot rule. When any patient is within 10 feet of any doctor or any team member, just acknowledge them, just greet them with a warm smile. Now, if you're with a patient, you really can't talk, you can't interrupt with the patient, but you could at least acknowledge them and smile and even nod. But if you're not with a patient, then do take a moment just to say hello. Gem number 2, think outside the box to help your patients and your practice. This is creative thinking. Several of my GEMS family members have been brainstorming, what are the things that we can do right now? Well, one of my GEMS members, Dr. Wolt, she created the option to skip the waiting room completely. They tell the patients, if you'd like, we can text you when your room is ready. They walk from their car directly into the back. Another GEMS member, Dr. Ferris, knew how many college students normally can't get in to see him because they're away at college. Well, right now they're all home, so his team's been reaching out and with really good results. Another GEMS family member said that she bought bulk pens online, only 6 cents each. Kind of a cool idea. At the desk, her team pulls out a new pen right out of the box for each patient, and then afterwards, small detail tells the patient just to keep it, and the patients have acknowledged that it was a really nice thing to do. What ideas have you or your team come up with that you could share with our colleagues? Please let us know in the comments below. Please share even the simplest little idea. We'd all appreciate your input. Dr. Pete Dawson wrote the foreword to my first book. Pete told me most always he refused requests to write forewords. The reason he wrote mine in his words, "Tom, I know you'll be a good missionary to spread the word about complete dentistry." Dr. Gordon Christensen wrote the foreword in my 4th and latest book, Transform Your Dental Practice from Coal Mine to Gold Mine. It's on Amazon for $16.97, but I'm happy to send you a copy as a free gift and appreciation for being with me here in the dental gold mine. I'll even cover the shipping. There are 2 gems in the book that could increase your annual revenue by $50,000. Potentially even 6 figures. While the offer is still available, claim your free copy at freegemsbook.com. That's freegemsbook.com. There's a link in the description below. Gem number 1, 4 sites you'll want to bookmark. See links in the description below to the ADA and CDC recommendations for infection control in dental practice, as well as links to the World Health Organization, status of the virus outbreak, Also, Johns Hopkins has Global Outbreak Trajectory Dashboard. What you see on your screen right now is the Johns Hopkins COVID-19 Outbreak Dashboard. It's updated daily, and you can follow the trajectory of the new cases as well as recovery from the virus. If you're a GEMS member and would like more one-on-one help during this crisis, don't hesitate to reach out to your personal GEMS concierge or schedule a call with your GEMS coach. If you're not yet a GEMS family member, Elizabeth and I would be delighted to have you with us here on Planet GEMS. For a limited time special offer on GEMS membership, visit dentalgoldmine.com. There's a link in the description below. If you have found this video helpful, subscribe to the channel and click the bell notification so you won't miss a thing. When you subscribe and click notifications, YouTube will let you know when I've released my next video on coronavirus. That should be very shortly. I'm going to cover in detail exactly what you should say about coronavirus in a letter to your patients. Was this video helpful? If so, please click like. Also, share it. Share the video with your team. Send a share to your colleagues near and far. Send it via email, Facebook, Twitter, Instagram. Thanks for joining me here in the Dental Goldmine. And remember, you're only one gem away.